Hi, I'm Natalie and I'm a research fellow at Birmingham Children's Hospital at the Institute of Child Health. Now, every year BCH gets another 50 new cases of brain cancer in those 18 and under. Some amazing progress and advances in cancer research in recent years. One of those is magnetic resonance imaging, which was about 15 years ago discovered. MRI to most people, including the clinicians. And although it's been great that there's been this drive and this technology and this push forward, sometimes we don't always consider how it impacts upon practice on the hospital side of things. So what is typically done here at BCH is once the child has been diagnosed, they will be in a consultation with their parents, maybe with other family members, and in that they will be shown an image like that of the brain with the tumour as quite a standard part. Now, although obviously clinicians sort of typically ask, is it okay if I show you this, or would it help if I, use this to explain? There's no actual, rigorous and systematic research to, and certainly no views of the patients have been gathered to know whether this is worthwhile.
I'm Professor Andrew Peat. I'm a children's cancer specialist, and in particular I look after children who have brain tumours. One of the things that I've become particularly aware about over the past few years is that we're increasingly showing families the scans that the children have as part of our consultations. And the families seem to be very keen to look at them, and they really think that they give them an idea about what's happening inside the child's head. But what I'm unsure about is how well we manage to convey that information, and whether or not what the families and children perceive really is what is correct. So we're going to study that in a very systematic research way, and I'm working very closely with some colleagues at the university who are used to going out and speaking with patients and with children to ascertain what their true views really are, so that we can use that information in a very systematic way to go back and help our practice and help us in how we communicate with families.
Now, clinicians are informed that there's a range of responses. Some patients, typically sort of more older, don't want to see it at all. They don't like the reminder that they're ill. They don't like to look at it at all. Some find it useful. Some find it helps them to be able to conceptualise or visualise their illness and what's going on internally. But there's been no evaluation, no research into this to gather, systematically information from the patient's perspective as how they find that useful and if they find that useful at all. So that's what this research is going to find out.